Today I'm going to be performing a routine 2-view chest x-ray. PA is one of our views and lateral will be our second view. I already have my computer set up, so we'll move on over to my console. And I'm going to make sure it's on wall Bucky for a chest, and we'll start with PA. The technique I like to use for chest, I just keep it ballparked at 115 kV and about 4 mass. And then if I see my patients a lot bigger, a lot smaller, I'll change it accordingly. And then for the lateral, I like to use about 120 and keep the 4 mass. And now I've already seen that my patient is a female. So in the room, we'll see how I set that up. I have detinted my tube to 72, and I've aligned it with the Bucky. And I also always like to just, before I even have my patient in here, stick my left marker on just so it's good in there. Same with my shielding, just extra steps that we don't have to do with the patient in the room. And I also make sure that my film is in, my IR is in lengthwise because I have a female patient. That being said, I also want to make sure that I grab this pregnancy form to confirm that she is not pregnant. So now we'll go get the patient in the waiting room. Stephanie?
Hi.
Hello, how are you?
Good, how are you?
Good. I'll have you come right in here. I'm Gianni, I'm going to take your x-ray. So I'll have you just remove your shirt, and I'll have you remove your bra. And you're going to go ahead and just put that gown on, and I'll have the opening in the back for me, please. And necklace too, if you have one.
Okay.
And can you just confirm first and last name and birthday for me, please?
My name is Stephanie Saunders. My birthday is 9/18/95.
Perfect. Thank you, Stephanie. And I'll wait for you right here, and then you can come on out when you're done changing.
Okay.
All right. We'll be right in here. Okay. Just close this door here. So Stephanie, any possibility of pregnancy?
No.
Okay, I'll have you fill this out for me.
Okay.
Thank you, Stephanie. I'll just set that right there. So, by any chance, have you been having pain in your chest?
No.
No. Okay. And then, about how long have you had a cough?
Yes.
Okay. And then, do you have pain with that cough at all?
No.
No. How long has your cough lasted?
4 days.
4 days. Are you a smoker?
No.
All right. No smoker. Have you been sick recently?
No.
Any surgery to your chest?
No.
Have you ever had cancer?
No.
Okay. And have you had any prior chest x-rays here at this facility?
No, this is my first one.
This is your first one. All right, so we'll make it nice and easy for you, Stephanie. Okay, so now I'm going to just move this shielding out of the way. I'm going to have you come as close as you can to my IR here, perfect. And I'm going to place the shielding behind you, so watch your step.
Okay.
I want my central ray to enter at T7, so I'm feeling for her scapulas, and they're right about there, so it's already set up perfectly. And there's some light above her shoulders, and as we can see, my collimation is lined up. My tube is lined up with my Bucky. Stephanie, I'm going to have you roll your shoulders forward for me and reach each hand on this side over here. Perfect. There's some handles for you to rest your hands. Keep your head nice and straight and tall and bring it up for me. I'm going to give you some breathing instructions as we walk out, okay? Take a deep breath in. Blow all your air out. Take another deep breath in and hold it. Boop, boop. Okay, relax and breathe. You can bring your arms down. Great. So now we're going to move on to the lateral. So I want to set up my console for that before I even go into my patient. So we'll move on to chest lat. And as we see, it's going to be at 120 kV and stay at 4 mass because she's an average size patient. So we'll just keep it how it is. Stephanie, that picture is great. Thank you. So now I'm going to have you come turn towards me. Hands up like you're going diving. Perfect like that. And I'm going to bring a handlebar for you to hold on to if you like. I'm just going to shift you as close as you can. Feet right under your body. Perfect. Thank you, Stephanie. Stand up nice and tall. This shielding is going to come and stand right by you again. Now I'm going to make sure that her CR, that the central ray is still going to be going through T7. And because I saw that I had all my anatomy and was in the right spot, I'm going to keep it and I'm not going to change, move my Bucky or move my tube. I'm gonna keep it right how it is. And I have some light back here, and then some light in front, so that's perfect. And my marker will still be showing, but will be out of the anatomy. I'm just gonna make sure she's not rotated, and stay as close as you can to that chessboard. All right, Stephanie, so I'll have you take a deep breath in and blow all your air out. Take another deep breath in and hold it. Boop, boop. All right, thank you. Breathe and relax, Stephanie. All right, Stephanie, that looks great. Thank you.
Thank you.
I'll have you follow me right back out here. We'll do the dress again. Right there, your things.
Thank you.
Thank you, and I'll wait for you. Have a great day. Hello, so we're gonna see how Stephanie's x-rays turned out. So I started with her PA view, and let's make sure I have all the right criteria. There's 5 things. So first, we have the apices of the lungs. Second, we have no rotation on her sternoclavicular joint, showing that she was straight on to the IR surface. And third, we have our 10 ribs. We'll go ahead and count them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 ribs. And we have our costophrenic angles. We can see the shadow of the vertebrae through the heart. And that is everything for that first chest x-ray. Now moving on to the second one, we have the lateral. So we see the apices of the lungs. We see that her arms are out of the lung field. We see the intercostal angle. We see the posterior ribs superimposed on each other. We can see the hilum right here, the hilar region. And then we also see the retrosternal space filled with air, and the retrocardiac space filled with air. And we have a clear x-ray here. Thank you.